Transition is very different. It is like steps, and those steps take you across this sort of border between pediatric and adult care. Instead of falling off a cliff, you have all that you need. You have the resources, the education, even the paperwork and the tools, so that when you go to adult care, you have what that physician needs in order to continue with your care. And also you feel that you've actually accomplished that by being educated and ready. Transition is a challenge for patients because of the fact that pediatric-based care, or their model of care, I think is very different than the adult model. Both have benefits, both are good. The pediatric care is more comprehensive, family-based, medical home-based, where adult is much more individual-focused and disorder-focused. So there's a big difference between the two. The family who has been pivotal in this all of a sudden has to reorient to where the patient is the priority, and they feel very excluded at times. This becomes more difficult when the child has special needs, because just because you've reached a chronological age doesn't mean you've reached a developmental age. And so some of these people suddenly are 21 but are not able to do all of their own care or to meet that. So the family still needs to be involved, and that's a reorientation for a lot of the adult physicians. When you're transitioning someone who really has complex issues and the adult provider is very reluctant, I think one of the very important things is to say, I'm still here. I'm here as your consultant. I'm here at any time you want to call. Here's my phone number. I think the other thing that's incredibly important is, like in our toolkit that we're working on, the medical emergency form. It gives the complete history. Be sure that the family and everyone else who's going to care with this child knows their complete history, so that it's not so sudden of a change and this physician receiving them. I think one of the changes that people are now realizing in terms of pediatric to adult care is the fact that with the advances in medical care, those disorders that were often fatal or thought to be fatal in many cases now are really very different. Those patients are able to live into adulthood. So from the adult side, it's like, well, I never see this, and suddenly they're going to be there. If you look at cerebral palsy, which wasn't that kind of fatal, 95% of those patients are going to be adults. If you look at dystrophy, Duchenne dystrophies, or now spinal muscular atrophy, which are disorders that were really thought to be limited to childhood, there are medications and changes over the last 10 or 15 years, and more recently as well, that are going to have these people clearly into adulthood. So we need to take care of these adult providers to be sure that they feel comfortable with those diagnoses, that they understand what's going on, because the patients are going to be there. We can't keep them in our services to when they're 35, because you can't be admitted to a pediatric hospital. So it's a real issue nationally. The Child Neurology Foundation sees transition as a major issue because they're looking to serve at where the national needs are. Given that there's a difference between pediatric and adult care and all the points that need to be done, then there needs to be a single voice to really help all of these individuals. And with that, it's looking at how we help the patients, how we help the families, how we help the providers, and how we help all those who are advocating for them. The consensus statement has 8 central principles or tenets. And globally, what that does is that it really looks at all the points that a child neurologist should endorse or look through or provide in order to bring this patient through transition, from the recognition of the need to the actual verifying that transfer took place or transition took place. So it's all of those. It used multidisciplinary approach, and so there was contribution from multiple individuals that represented other groups, therapists, families, actual patients, neurologists, pediatricians, and the list goes on. And all those people were at that table to bring this forward. Additionally, it didn't stop there. It was endorsed by multiple societies, and that included the American Epilepsy Society, the Child Neurology Society, the American Academy of Neurology, the American Academy of Pediatrics. So with that, it sort of speaks to multiple groups, and they, with their endorsement, have really verified that this is a consensus.